I'm Ann Williamson. I'm the Chief Nursing Officer here and the Associate Vice President for Nursing for UI Healthcare. And this is actually for you all. We working with Maria Lothran. We did a survey, and then also looking at our other UHC peer groups, other academic health centers across the country, are starting to put together councils for the term we don't like to use, mid-level providers. Their ARNPs and PAs across their organization, really trying to meet their needs, because as your ranks grow, we want to make sure that you're recognized, that you're appreciated, that you're not invisible within the organization. You provide a huge service to our patients and to the organization as a whole, as well as the departments that you work within. We have two very special guests here today to help kick this off. Ken Cates, the CEO of the hospital, and Dean Rothman from the college, and so I wanted to give them a few moments at the podium.
Please, Dean Rothman.
So, thanks, Ann. So, one comment I would say is that when, my name's Paul Rothman, but since I took this job, my name is now Dean Rothman. I get letters that, Mr. Dean Rothman, Dr. Dean Rothman, so I didn't quite know that was going to happen. But thanks for having me, and I want to congratulate Ann and her group to start this council. So, when these academic medical centers are huge, complex organizations, and I don't have to tell you all that. And then when you look at it, for me, I got students, and we recognize and help out students, and I got faculty, and I deal with faculty. And then, so in the college, one of the things we've tried to do, both when I was a chairman of medicine and now, is try to think of what groups aren't really represented and yet are important. So in medicine, we had, for instance, fellows. Postdoctoral fellows are both the clinical fellows that do the clinical rotations and the scientific PhD postdocs are the one group that is so essential to us, but they really didn't have any representation. And so over the years, we've tried to work on it because they're so essential, but because they just, when we set these things up, they just somehow, and then when Ann started to, about 6 months ago in, and it was like, duh, we have PAs and RNPs, you guys deliver a huge amount of care here. I was looking for Molly, my OPA in the rheumatology clinic, and God, without Molly, I wouldn't know, I'd be lost. I wouldn't have known how to use IPR, let alone so, I had this partner, and so when she said, we don't really have a representative group for ARNPs and PAs, we said, yeah, this is really important. And so I want to give kudos to her, and really, I hope this council really gets you all together and directs your issues. So the one thing that you'll learn with Ken and I and Dr. Robiart is we really are trying to incorporate everyone in the organization, and it's going to be a little bit of a change, but we meet with staff councils once how often, Ken? Once a quarter?
Every couple of months.
Yeah, and again, just trying to hear what people are doing and making sure that we can try to help people as much as we can, and having this council to really tell us, what are your issues, what we can do to help you. I think it's going to be really helpful for us as we move UI Healthcare forward and try to make sure that we're a great organization. So first of all, thanks for everything you do, and it doesn't go unrecognized. As I say, I know the physicians really appreciate what you do. The patients really represent what you do. So thank you for that, and I look forward to hearing from you, and anything that the college can do to help, just let us know. That's all I can
Thank you, Dean Rothman. I just want to reiterate everything Ann said and Paul said. My job is really to just say 2 words to you. It's just thank you. You make a huge difference in everything that's so important to patients and to families and to staff every day here at UIHC. And you and your colleagues are incredibly important to allow us to take what is a very, very good organization and make it even better. And And as Paul said and as Ann said, we're absolutely committed to doing that. And we really want to hear recommendations and suggestions. You all understand far better than many of us really what we need to do to make this a better organization. So push back, make suggestions, and hopefully this will be a good forum to support that. So thanks very much, and look forward to hearing a lot of feedback. And Ann, thanks to you and your team for pulling this together.
Okay, so I would like to take just a few minutes to recognize some other special guests in the room. And Maria, I want you to come up here and make sure I don't miss anyone. We have Dave Asprey from our Physician Assistance Program, and many of you, how many of you are PAs? So how many of you are PAs from Iowa, graduated from Iowa? So a few. So you probably know Dave, and we are going to be co-opting him as well as our other colleagues in the College of Nursing to help us with this council as we go along. Other people in the room representing the midwifery program, Laura Delos, so Laura's there. Ann Smith from our CRNA program, and I guess the director within the college was not able to come today. I wish. No, the CRNA program director. Yeah.
He's in the upper.
Okay, yeah. And Mary Berg from our pediatric nurse practitioner program within the College of Nursing. And then Maria Lofgren, who is our neonatal nurse practitioner here for many years at the hospital and has been instrumental in helping me. I've been here a little over 2 years now. And Maria, I think within 2 weeks of me arriving, was really helping me to understand this group, who you are, and you have grown in 2.5 years, really. You'll see in the slides in a minute, more than 206 providers, ARNP and PA providers, and we're continuing to see ways that your providers, you as providers, can help us within the organization. So there's recruitments underway as we speak.